Hi, I'm Jonathan Staiano and this is 5 questions to ask your breast reconstruction surgeon. So the first question that you should be asking your surgeon is, can I change the size of my breasts? It's obviously a very traumatic time if you've been diagnosed with breast cancer, and there's a lot to consider. But when I'm talking to someone about breast reconstruction, the first thing I always ask is, are you happy with the size and the shape of your breasts? Because there's no point in reconstructing a breast to look like a breast that you don't like. So if you don't like your breasts, if they're too big, if they're too small, or if they're too droopy, there may be things that we can do to adjust your other breast and to reconstruct the breast to match it. So it's important to talk to your surgeon and to voice any concerns that you have. If you felt that your breasts have always been a bit too small or not the right size or shape, then voice that to them to see if it'd be possible to get something out of this and to actually have a breast reconstruction that's hopefully better than your original breasts. The second thing you want to ask your surgeon is, will I need further treatment? Because it's often possible to predict whether you're going to need further treatment for your breast cancer before you have your mastectomy. When I say further treatment, I mean radiotherapy or chemotherapy, what we call adjuvant treatment. Now sometimes we do the mastectomy and we find things about the cancer that we didn't know before, so that decision can change. It's not always possible to predict, but often it is possible to predict. So if you do need further treatment, if you do need chemotherapy or radiotherapy after your mastectomy, that might affect your decision as to what sort of reconstruction you have. Because if you have a big elaborate reconstruction with risks of wound healing problems and a delayed post-operative course, it might delay your chemotherapy and radiotherapy, so you might think, actually I'm going to have a smaller operation or maybe no reconstruction at all and opt for a delayed reconstruction at a later date. So the third thing you want to talk about is how long the recovery is. It's important when you're having any surgery to know how long it's going to take to get back on your feet, and obviously you're going to have different lengths of time in hospital and different post-op recovery, and it depends on what type of reconstruction you have. There are different ways to reconstruct the breast. You can have an implant reconstruction, or you can use your own tissue, and if you use your own tissue, broadly speaking, it usually comes either from your back or from your tummy. So for instance, if you have an implant reconstruction, you might be in hospital for a couple of nights. If you have tissue from your back, you're looking at about 4 nights in hospital. Tissue from your tummy, which is a diep or a tram flap, probably a week or so in hospital. And then you've got your post-op recovery to get you back on your feet. These are big operations, it's quite a long anaesthetic, so you do feel tired and jaded for a good few weeks afterwards. You have wounds to heal, scars to settle, and the scars can take months for them to settle. The sensations often abnormal, feels weird, feels numb, feels overly sensitive, and that can take many months for that to settle. And sometimes you can have residual abnormalities in the sensation. It can always feel a bit numb or a bit sensitive. So these are all things that you need to be discussing with your surgeon. So you need to know how long you're going to be off work, how long before you can start driving again, when you'll be back on your feet and start to feel normal again. The fourth thing you want to talk about is, how long is the reconstruction going to last? When you use your own tissue from your tummy or from your back, it tends to last longer than when you use an implant, because an implant does have more of a lifespan to it, particularly in terms of breast reconstruction. Because when you use an implant for breast reconstruction, particularly if you're just using an implant on its own, you just have the implant and then your skin over the top of it. So it can go hard and it can feel uncomfortable after a few years, especially if you're going to have something like radiotherapy, for instance, which can accelerate the scarring that happens around the tissues. And so you might think, well, an implant reconstruction is a quicker operation with less recovery, less downtime, but they're more likely that you're going to need another operation in a few years' time, because it might start to go hard and it might get uncomfortable. And so you might say, well, actually, I'd rather have a bigger operation now, which is going to last me for longer. As I say, it's different things for different people, and it depends on what stage you are at your life and to what you think will be right for you. But it's all about balancing these things and asking the questions before the surgery so that you can make an informed decision. The fifth question you want to ask is, what about if I need another reconstruction in the opposite breast? So obviously when you're having a mastectomy, then you're trying to reconstruct the breast to look like the natural breast, the unaffected breast. But you might be thinking, well, actually I'm at a high risk, and have I got a chance of getting cancer in the other breast? Now unfortunately, cancer is a common a common thing, particularly breast cancer. And so unfortunately there is a risk that you might get a cancer in the opposite breast, and you might need to have a breast reconstruction in that side. And again, that might affect your decision as to what type of reconstruction you can have, because some types of reconstruction, particularly the tummy, when you take the tissue from the tummy to reconstruct the breast, you can only do that once. So you can't do it again if you're having a reconstruction on the opposite side. Obviously, if you are at high risk of needing a reconstruction on the other side, you're probably going to want to have a reconstruction the same way you had the first reconstruction to maximize your chances of getting good symmetry. So if you've got a high risk of needing a reconstruction on the other side, the tummy is maybe not going to be one that you want to be thinking about, because you won't be able to use that later on. You could use it at the time, and sometimes people who are very high risk of getting a breast cancer opt to have what we call a prophylactic mastectomy, which means they have their normal unaffected breast removed at the same time that they have the cancer treated. But this is something you need to discuss with your breast surgeon. Other types of breast reconstruction, like when you use tissue from the back or when you use an implant, can be done if you need a reconstruction on the other side. So again, it's all about being fully informed about what the options are so that you can make the right decision and an informed choice. Those are the 5 questions you need to be thinking about talking to your breast reconstruction surgeon about. But I've got to say, people do get down into the minutiae of things, and there's a lot to take on your plate. So please try not to worry about it too much. There are pros and cons with anything. There's no such thing as the right decision. There's no such thing as the perfect way to do anything. And I always say the most important thing that you've got to do is choose your surgeon, find someone that you can trust, and when you work with a surgeon that you can trust, that is where you're going to get your best result. Don't worry too much about the ins and outs of exactly what sort of technique they're going to use, whether you have an immediate or a delayed, whether you have tissue from your back, your tummy, implant, no implant. These sort of things are important, and you should be involved in the decision making, but you really need to work with your surgeon, because your surgeon will have all of the knowledge about the type of cancer that you have, the type of mastectomy or risks that you're going to face in the future. So really work with your surgeon, try not to worry too much about the details, and good luck with everything.